Good evening, and thanks for joining us. It is the latest sign of major gaps in the healthcare system. Two family doctors on the same day telling their patients they're retiring and there's no replacement. It means thousands of people in White Rock and in Victoria are now left scrambling to find new doctors. CTV's Rob Buffum reports.
Nearly 4,000 patients just got the word they'll have to find a new doctor in Victoria.
I know a lot of people are like me, are looking for doctors like this, and to see one doctor go is, heartbreaking.
This clinic is closing at the end of March because one of the family doctors here is retiring.
I'm so nervous and just very, especially when you have your elder person.
Dr. Lauren Verhulst says 45 years in, it's time to retire. He couldn't find a replacement willing to take on the gig and says the province should step up and help pay the cost of leasing and running an office like this to make it more attractive for future doctors. He feels like the system is letting patients down.
Imagine you go to the local school and you want to enroll Johnny in grade 2 and the school says, sorry, we're not accepting new pupils. Well, that's the situation in medicine.
This is not the only doctor's office where patients got bad news in the last few days. The same letter went out to patients at a doctor's office in White Rock. One of those patients, BC United MLA Trevor Holford, who tweeted about his disappointment.
I have a community that is full of seniors, and that is where my my focus is because a lot of seniors in my riding do not have access to a family doctor.
The health ministry told CTV in a statement, "We recognize the stress it puts on patients when a clinic closes or they lose access to a primary care provider. That's why we're hiring more primary care providers, including family physicians, and changing the way we compensate them so it's more competitive. We're also reducing barriers for international medical graduates to work in BC." This family physician says the new payment model rolled out this year is helping retain GPs, but she wants to see data about how many more doctors are needed made public.
Improve transparency, better leveraging of data that they have.
So the million or so patients without a family doctor in BC, now joined by an extra several thousand, aren't left with unanswered questions.
What are you going to do now? What we are going to do?
What are you going to do?
Rob Buffum joins us live now. Rob, speaking of data and transparency, what's the status of the province's program that matches patients with family doctors?
Well, that program that was rolled out this past July, it's not clear at this point how many people have signed up for the registry, nor is it clear how many people have actually been matched with a family doctor after signing up. Patients I spoke with today told me that they had been told it would be at least another year before they were matched. When I reached out to the government to ask them what the status of those numbers were, they said that data was not available, but they would make it available in the new year. Mijun.
Frustrating time for so many patients in BC. Thank you, Rob.